The average person spends approximately $2,000 on the wrong treatments before they find out what actually works best for them. Today, I'm gonna save you time and money by discussing two very popular and effective treatments, microneedling and chemical peels, and where they fit into your skin anti-aging continuum and which one you should choose for your particular skin needs. And if we haven't met already, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And if you love learning about how to manage your skin aging process and facial rejuvenation, make sure you tap the bell and subscribe to this channel. I drop a new video filled with insights and strong opinions about how to remain empowered and making good decisions for yourself as you go on this journey of anti-aging. All right, so what will we cover today? We're gonna talk about the science behind microneedling and chemical peels. Next, we're gonna do a side-by-side comparison of pain, cost, and even results. Next, we'll talk about who makes the best candidate for each of these treatments, and even how to combine them together to get even better results. Plus, one big mistake that people make that make both of these treatments significantly less effective. All right, so let's talk about the science behind microneedling. So microneedling is the process of penetrating the skin literally thousands of times with a sterile needle at specific depths in the skin that is going to stimulate collagen as a result of a perceived injury to the skin. So follow me for a second here. Collagen diminishes with age. It peaks around the 20s, and then each decade you're losing significant amounts of it. So it's in everyone's best interest at every age to increase the production of collagen and turn the curve back up. So what happens is we found that injury results in stimulation of collagen at the level of the fibroblasts, which is at the end of the day a great hack to get the skin going again, right? Because the skin starts to get lazy as time goes on and it starts to thin and get lines and wrinkles. That's all because of collagen loss. So if we can find ways to stimulate collagen, we're gonna have less wrinkles, more supple, strong looking skin. So put that all in the frame of everything I'm about to say is related to targeting changes related to skin aging. That's why we're doing these procedures in the first place. So what is the proper technique and some depths that you should keep in mind when you're looking at microneedling? The needle in any of these devices penetrate a specific depth in the skin. Around the eyes and the periorbital area, you don't want to penetrate more than 0.5 millimeters. The cheeks, the skin gets a little bit thicker. The forehead, the skin gets a little bit thicker. You can go up to about 1 to 1.5 millimeters in depth. Now you're getting, again, in both areas where you're targeting is the middle of the dermis, which is the kind of thick part of the skin. Now for areas that have lines and wrinkles that are thicker, say around the mouth, or you have acne scars, etc., you actually can go up to 2 to 2.5 millimeters in depth. Neck skin is very thin, so you generally want to keep that less than 1 millimeter. And anytime you're going to have these treatments, let me just say as a caveat, you always want to treat your face and your neck in the same time, because face and neck age together, and nothing looks more unusual than having young-looking face skin and age-looking neck skin. And this is something that a lot of people have to play catch-up with as the years go on because they neglected their neck along the way. And that includes using product and sunscreen. Make sure you don't neglect your neck. Now, a lot of you have probably heard that there is an at-home version of these type of microneedling devices. The issues with the at-home versions, and this is why I generally don't advocate for them. Number one is their penetration depth is shallow. They're usually between 0.25 and 0.5, which in most parts of the skin doesn't get into that deeper part of the dermis, which stimulates the collagen, etc. You just don't get as much of a robust collagen stimulation change as you would otherwise. One of the things that I always advise people on is you want to make sure you're using it in a sterile way. Every time this needle is penetrating to the skin, it's introducing the potential for bacteria into the skin. A lot of times people at home just don't understand sterile technique. They don't understand proper sterilization. So they're using these at-home things and risking potential infection. And sometimes you can pick up some pretty nasty bugs and as a result have a really, really unfortunate skin infection that's either hard to treat or spreads. Now, I will also say that it's a matter of convenience, but sometimes the convenience can mean that you over-treat something when you have it at your disposal. So if you're gonna do it at home, once every 2 weeks is sort of that range, and make sure you adhere to good sterilization techniques. Now, the next category is radiofrequency microneedling. Radiofrequency microneedling is where in between the needles, there's a current that goes through which stimulates collagen production because more injury is being generated. So there's this greater inflammatory event that causes the skin to potentially output more collagen. So it's kind of like elevating the effect of it. But with it comes the elevation and cost, which we'll talk about in a moment. Some of the data around that show that using radiofrequency can increase the efficiency of collagen production by up to 60%. That's a big number. Now, here are some caveats, and I've done several videos on why I don't like radiofrequency microneedling, Morpheus 8, etc. Now, I want to make sure you understand I have a radiofrequency microneedling device in our office. The difference is between this and Morpheus 8, for example, we are not using it for laxity of fascia, right? So if your face is falling, jawline is lax, neck is lax, you have jowls, etc., we're not using microneedling with radiofrequency for those purposes because those indications require you to increase the depth of the needle down to 4 or 5, sometimes even 6 millimeters, which puts the deeper facial fat and the superficial facial fat that's below the skin at risk of loss. So there's some complications and consequences, and rarely do you see any significant change with those to justify loss of this precious subcutaneous fat that we want to maintain as much as possible because that's what gives the skin that suppleness. So I'm not a fan of deep microneedling with radiofrequency, but if you keep the level of penetration around 1 millimeter, you're good to go. So if you have especially crepey skin, especially around your neck, or especially greater levels of scarring or acne scarring, etc., microneedling with radiofrequency can be very, very good. Just keep that 1 millimeter rule of thumb in your mind when you're talking to your provider. And I want to point out that my wife, who is a tremendous skin advocate and enthusiast and is taking great care of her skin, uses microneedling on her neck skin. I think it's every 6 weeks or so. So she's been doing that for years. She comes into the office, gets her neck skin. She doesn't need it on her face, but genetically her neck skin thins a bit based on what we've seen, her own aging process. So stimulating neck skin is something that she uses microneedling for on a regular basis. Consistency is key, and I'm gonna point this all out in a moment, but these are not one-time treatments. Everything I'm about to share, including chemical peels, these are repetitive treatments. You can't expect that much out of one treatment, and you can't expect that much out of several treatments and then stopping. That's an important point to make. Consistency with these procedures are excellent enhancement to the collagen stimulation game that I think is really at the crux of skin anti-aging. All right, so now let's talk about the science behind chemical peels. Now there's a variety of different chemical peels, but fundamentally they all work in the same general fashion. The chemical peel is functionally an acid, and acid causes this skin barrier, depending on the level of the peel, to basically separate, leading to this superficial layer above that to peel off. Oftentimes in that layer that comes out are pigments that are resting in these superficial layers. And by removing that skin, you're also removing the pigment. So the skin pigmentation improves as well. So it's using a chemical reaction to basically trim the skin, essentially. What's in that layer that comes out are dead skin cells on the upper layer of the skin, the epidermis and the stratum corneum, which is the top layer of the skin that gives the skin that kind of dullness. The epidermis, which is just below that comes off in most peels. So there's a brighter looking skin that is renewed as the healing process carry on. And deeper chemical peels can go down into the dermal layer, which can affect fine lines and wrinkles, etc., and get even a more robust overall improvement. So if you think about it, it's a very, very effective thing to take that dead layer, old layer of skin off and let new skin come forward. That's the concept of a peel. Another point to keep in mind is that process that we just went through, the inflammatory process, is an injury. Injury in healing leads to collagen stimulation. So there is a bonus effect in terms of glow, stimulation of collagen, and improving pigmentation that you're getting with chemical peels. Now remember, with microneedling, you're not necessarily getting any changes in pigment, but you are stimulating collagen. and you're not renewing the surface of the skin, which you are with chemical peel. Important distinctions to make. So what are some mild or superficial peeling agents? You've probably heard of glycolic acid. These generally are for fine lines and even brightness. You've heard of salicylic acids, which can help decrease oils and help with acne. TCA is a very, very common one. TCA is used in multiple different strengths. It can be a superficial peeling agent. It can also be a medium peeling agent, and I'll describe what that means in a moment, and a deeper peeling agent. TCAs are great for pigment. They're great for fine lines and wrinkles, and they have that variability associated with it. Phenol peels is another type of acid generally used in deeper chemical peels for deep lines and wrinkles. It's not used that often anymore because it's kind of a to-do. There's a big downtime associated with it, but it can be very effective in terms of improving those superficial and surface fine lines and wrinkles. Now, here's something to keep in mind. All the peels that I just mentioned, majority of them, with the exception of TCA and phenol, are able to be done with your esthetician. They're able to be done even in some cosmetic products. You're going to have some of these peeling agents in there as chemical exfoliation. But once you get down to wanting to get really down to business and deeper peels, meaning like a superficial medium depth, you really need somebody who knows what they're doing with these peels, because there is always a risk of overdoing it, and overdoing it could lead to scarring, it could lead to hyperpigmentation, etc. One caveat to keep in mind also as you're watching this, if you are somebody who has olive toned skin, skin like mine or even lighter than mine, that tans easily, etc., you are susceptible to potentially having hyperpigmentation as a result of a chemical peel. You don't have that issue with microneedling, but you do have that issue with chemical peel. So usually if you're gonna have a medium depth chemical peel, this is just a thing to jot down and keep in mind, you wanna make sure that your practitioner pre-treats your skin. And if they know what they're doing, they'll do that without you having to remind them. But that means you're on some type of lighteners, retinol, vitamin C, licorice root extract if you're going the botanical route. Trifecta is an incredibly potent anti-hyperpigmentation combination that helps a lot of people in that way if they're already on it. Hydroquinone is a classic. The classic is 4% hydroquinone plus retinol. Prevent the skin from hyperpigmenting after a chemical peel. So just keep that in mind. So here are some concentration levels. Let me just have a look here and share this with you. So for at-home use, 10 to 30% glycolic is perfectly safe. Again, don't overdo it. If you're gonna come into the esthetician's office or your dermatologist's office, you can go to 20 to 70% alpha hydroxy acid and beta hydroxy acid peels. Now, if you're gonna get into the 20 to 35% TCA, you definitely want somebody experienced, and this is usually a doctor who does this, because it is a definitely higher risk procedure if it's done without somebody knowing what they're doing. And it's not commonly done by people who don't know what they're doing, but people who know what they're doing, they love it. I love a chemical peel. I've been doing it for years. I don't do it so much anymore. Again, a lot of our patients come into surgery already on trifecta, so their skin looks pretty incredible. So we're not doing a lot of resurfacing, but when I was doing peels for patients who, we wanted to get their skin going, I love the 35% TCA chemical peel with a little bit of Jesner's. So here's another way to think about it. If you're doing superficial, very superficial peels, you're talking about essentially no downtime. At the most, minimal downtime, a little bit of redness, etc. For medium depth peels, you're getting down to the papillary dermis, you're gonna have more redness, more inflammation, more peeling, and you're talking about usually bigger downtime, but also bigger results. And that could be anywhere from days to a week, depending on the combination and the concentration. When you get into the deeper level, it's, again, can be up to a month, but the changes can be pretty impressive. Very, very few people do those deep chemical peels anymore. It's just too much to go through. But overall, lovely treatment. Like I said, pigmentation, fine lines and wrinkles, collagen stimulation, all of this improving glow and suppleness of the skin. It definitely has a place in the armamentarium. All right, so I'm just gonna go through some thoughts here. So side-by-side comparison. As far as pain goes, microneedling, you're gonna use a numbing agent. It's gonna be slightly more than kind of like a sandpaper feeling on the skin. If you're feeling more than that, you should probably ask for more topical numbing. Peels is more of like a tingling, kind of a burning sensation, definitely more sensitive than microneedling because you're not typically putting any type of topical on the skin to numb the skin. You just have to kind of bear through it. If you're gonna go for the deeper peels, you're usually using sedation, so you're not gonna feel as much, but nevertheless, there's a period of time during the peel you're gonna be uncomfortable. As far as recovery time goes, microneedling, usually 1 to 2 days. I don't even notice my wife when she goes through it. It was usually a night or two of some redness and then it goes away. Peels, again, depending on the depth, it can go from literally like hardly any downtime, maybe a day, to a week or two, depending if you go to the medium depth level. Now this is important. As far as sessions go, microneedling you want to do at least 3 to 6 sessions back to back. And then you want to start to do them on a frequency, say every 6 weeks or every 12 weeks or some frequency that works for you and your budget, but you want to keep the results going. You definitely don't want to do this and then stop. Unless you're good with where you are, you kind of boosted your skin where you wanted to be, and then you're doing what I'm about to share with you on a regular basis to keep the results going. Superficial chemical peels are usually done every 4 weeks, and then when you get to the more medium depth level, it's like 1 to 3 times a year. 3 is a lot of downtime to go through. So generally speaking, you want to do it probably 1 or 2 times a year at the most. So here's some cost analysis. So basically microneedling is anywhere from $250 to $700 per session. If you add radiofrequency to it, you're looking at somewhere in the range of $700 to $1,200 per session. Chemical peels are less expensive. They're typically between $150 to $300 for the superficial variety. And then if you go to the deeper levels, medium and a little bit deeper, you're looking at anywhere from $1,000 to $3,000. And of course, all of this depends on the facility and the doctor and all these other things that are going on. But there, as you can see, it's significantly less expensive going the chemical peel route. So if you're on a budget, this might be a consideration worth taking. None of these treatments have true longevity. I want you to understand that anything you're doing like this, you're basically stimulating, going above and beyond where you currently are. But once the stimulation is over, the skin begins to resend back to where it was. Maybe it's 6 months later, maybe it's a year later, maybe it's 2 years later, but you kind of get back to your starting point. All right, so who are the best candidates for these procedures? Microneedling is really a collagen stimulation thing. So if you have fine lines and wrinkles and you want to boost up your collagen, microneedling is the way to go. It's not ideal for people with pigmentation. It's also not ideal for people who have discoloration or kind of dullness to their skin. It's also an excellent treatment just to get done if you have darker skin type because of that hyperpigmentation issue that I talked about earlier. It can help with acne scars, but it doesn't really help with active acne the way like a salicylic acid peel would help with. Chemical peels, on the other hand, they're best for pigments, glow, and even fine lines. They're less effective for the deep scar, and they can also be a little bit too much for people with sensitive skin. Microneedling would be better. All right, what if you want to combine these things? So remember, there's benefits for both, right? So if you plan on combining it, which is not an uncommon practice, this is how you want to do it. You start with the chemical peel. You do 2 or 3 sessions with that. Get the skin kind of looking healthy and great. Pigmentation decreases, glow increases, etc. Then you do microneedling to work on specific structural things, fine lines, wrinkles, etc., or just to stimulate more collagen ongoing. If you're doing superficial chemical peels, wait around 2 to 3 weeks. If you're going deeper, go 4 to 6 weeks before you start microneedling because the skin can be a little bit too sensitive. And honestly, the same applies for the use of your active skincare routine. Like if you're on these things, you definitely want to wait a little bit till your skin recovers before you reintroduce it, especially if you're using full-strength retinols and vitamin C. If you're using the trifecta, usually a week or 2 after the treatment, you can get right back into it. So why would you combine? Again, it's a targeted approach. Pigmentation, dullness, chemical peel, stimulation of collagen, better with microneedling. So combined, you're getting a little bit of the best of both worlds. But here's the thing I want you to keep in mind. Everything here, including pigmentation and stimulation collagen, is on a short duration after the treatment. So you're gonna get a boost from these treatments. You're gonna reduce pigmentation, but guess what? More pigmentation is coming right back up. More collagen degradation is happening. You're basically going forward and then drifting backwards. And this is where the next point comes in. None of these things are permanent changes. Nothing really ever is, but there's things that give you longevity. You get a vertical restore, for example, and you're not getting any kind of like facial tightening procedure for years and years to come, 10, maybe even 15 years before you do another surgery. But you do these type of treatments, you're not getting that type of duration out of it. But what you need to realize is it's the daily active skincare that is going to keep your skin getting younger and younger. Sun protection and daily use of actives is your daily diet and exercise. That's the best way, most tried and true way of getting your body healthy and your muscles, improved and your shape back, etc. Then you want to speed things up a little bit. You go do a boot camp. That's where your chemical peel and microneedling come into play. They are enhancements on top of what you do on a daily basis. Without the daily basis part, you're just going forward, drifting back, going forward, drifting back, going forward, more or less staying in kind of the same place, unless you're so consistent with the chemical peels and microneedling that you're actually making progress going forward, which you can. And this is why I say, it's depending on how you want to approach your skincare. To me, going through downtime seems to be impractical for a lot of people. So what they do is they spread these out too far, and then next thing you know, and obviously the cost, if you add the cost into something you're doing on a regular basis, you can see the cost can become very, very expensive. And ultimately, it becomes impractical as a primary foundational part of anti-aging skincare. And this is really, at the end of the day, why I developed the trifecta, because people had no idea what they needed to do for their skin. There's too much confusion, there's too many steps, too much irritation from products, etc. And I basically wanted to make it super easy, super effective, and easy enough to be able to do on a daily basis. 3 steps, in and out, takes a minute or two per application, morning and evening. Combine that with sun protection, your skin's getting better and better, with or without the use of chemical peels and microneedling. But if you do these things on top of it, well, you're gonna get even more out of it, right? So that's the whole concept. So if you wanna learn a little bit more about the trifecta and skin, the actives that we use in it are all embedded in those 3 products. So it really kind of makes it easy, because I guess I've spent 4 years working out the details and do the thinking for you. So it makes it easy on you. But bottom line is that's how you need to be thinking about this, and not thinking about it in reverse order. All right, so here's some final thoughts. Neither treatment is better than the other. They have their place. I love them both. I really do. I've been using each of them for over 20 years. They have a place in our practice. Choose which one you want to do based on your budget, your goals, what you're looking for, and now you know what to expect from each of them. So don't do microneedling if you want your glow to come back and pigmentation to improve, right? So that's important. But if you use chemical peels, microneedling, as tools and enhancements above and beyond what you're doing on a daily basis, you are going to win. Simple as that. These are solid. These procedures are not going anywhere. All right, so which of these treatments caught your interest? What are you more curious about? Which ones have you done? I'd love to hear your feelings about them. Was there any surprises in this video? Any aha moments? Anything that gave you a moment of pause or motivated you, inspired you to try these treatments? We'd love to hear. This is a community. We're all trying to learn from each other. I'd love to see those stories and your experiences in the comment section. And if you haven't already, make sure you like the channel and share it with some friends. And if you haven't already, make sure you subscribe to the channel so you can receive weekly videos on topics like this and others that are all related to anti-aging and empowering you to make the right decisions. And if you want to delve even deeper, make sure you subscribe to the Karam MD Journal, and that's in our description below. And make sure you watch more videos about skincare and facial anti-aging on the channel and our playlist. I think you're going to find them to be very, very empowering and helpful for you as you're on this journey. Until next time, my friends, Dr. Amir Karam.